Are you tired after hearing long speeches? Okay. Be cheerful. Cheer. Everybody. Cheer. Right. So that anybody sleeping in the corner, they will be awake. Okay. Before going into the topic, I am Somasundaram from Annamalai University, Tamil Nadu. It's the second university started after Madras University in Tamil Nadu. It is 87 years old. You name any faculty, it is there in the Annamalai University. We are having engineering and technology, we are having agriculture, we are having medical, we are having pharmacy, we are having dental, of course, the arts and science and commerce and management courses. So all the departments are there in the Annamalai University, and I belong to one particular faculty. I am a rare species here. I belong to the Faculty of Marine Sciences, and of course, I am purely a biologist and work on various aspects which include one of the aspects is looking for some molecular leads which has potential drug value. It can work against the proliferation of cancer cells. And today's my topic is some antioxidant and anti-tumor potential of fucoideans from marine brown alga, Herbaneria conidus. Brown alga is nothing but the seaweeds. Normally seaweeds means what? We will remove from the field. But here the weeds are very valuable product, and Japanese, they very well know what's the value of seaweed, because they used to call it a sea vegetable, a part of the work which I am going to present today. So, among the cancer, I chosen the pancreatic cancer is very, of course, you cannot, maybe by molecular markers we can detect earlier. Earlier diagnosis is a big issue to identify such cancer, and pancreatic cancer is the one. And with an estimated 5-year survival rate of less than 6%, that survival, if the person is identified with the pancreatic cancer, maybe 8 months or something like that, and that his life expectancy will be very shorter. Pancreatic cancer load in India is somewhere around its collected data, it's 17,000 patients, and it's likely to increase. And this cancer has very poor prognosis, with more than 90% of patients having unresectable tumors at the time of diagnosis. The poor prognosis can be attributed to the fact that they are extremely resistant to the available chemotherapies and radiotherapy. That's a problem. When giving the chemotherapy, it's not at all responding because it's more resistant because of some molecular machinery which is not functioning properly against when the patient is given with some chemotherapy because it's giving resistance. And just known drug is gemcitabine, is the only clinically active drug to treat pancreatic cancer that will improve the lifespan by 5 months or 4 months, maybe 5 to 8 months. That's all. And so now the interest comes like this, because of this incapable drug availability, or the drug which are available is not suitable to treat this particular cancer. Then now people are looking into various sources which can capable of controlling the disease, and that is the idea. So all these aspects I have given. One particular, if you are looking into the seaweeds or the marine algae, macroalgae, they are capable of, and they are producing a lot of metabolic waste product. Then you may ask one question, why? The reason is the marine environment is a so variable environment. The plants or animals which are living in that particular environment has to adapt to live in extreme conditions. So they have to produce certain metabolic product, I mean metabolic, secondary metabolic product that is having tremendous value. That is why people are looking into the marine animals or these kind of algae and try to evaluate the potential nature of the molecular leads. So the methodology what we have used, which we looked at actually this particular paper, we looked into the sulfated polysaccharide, otherwise known as succoidans, and the Turbonaria conidus is simply put as TCFE because the TC refers to the Turbonaria conidus, F refers to the fucoidin extract, E refers to the fucoidins. And we have done all these sugars, sulfate, protein, uranic acid, and elemental analysis, and FTIR. And this paper is being published in the Biological Macromolecules. Antioxidant assays, we have done this one criteria which will very much helpful to screen the different kind of macroalgae is first to test whether it is having any, fantastic antioxidant property. Then if you are, most of the natural products are having such property, even then it's one of the screening method to understand whether it may have the anti-cancer property or not. So through this particular analysis, we will enter into the next phases, the anti-cancer property using some cell lines. And we looked into the hydroxyl radical scavenging, superoxide radical scavenging assay, nitric acid radical scavenging, DPPH and ABTS. These are the assays we have tried. The pancreatic cancer cell lines we used MIA-PACA2 and PANC1, which is a representation of the pancreatic cancers, and we have done the MTT analysis and propydium iodide staining. It particularly refers to the method of the staining, which will helpful to evaluate whether the control of the cancer growth through apoptosis. And this one technique which will helpful to understand the type, and later we can do DNA fragmentation also, and then subsequently gelatin gymography and CAMS. So these are the chemical analysis, FTIR. And here you can see we take gallic acid as a standard to understand whether it is having an antioxidant property or not, and we try with the different microgram per ml of the product which we are isolated, and try that it is increasing with the increasing concentration, the scavenging acid. And next, we tried with the superoxide. Here also see the same trend when the concentration is increased, but of course it twofold when compared to gallic acid. We need the concentration which should twofold of the extract. And of course the nitric oxide also showing same kind of trend, and DPPH of course. MTT says one of the methods we have used a cell line MIA-PACA2 cells, where we try to evaluate it is controlling the proliferation of the cells during various incubation periods. We have tried with 24 hours, 48 hours and 72 hours, and concentration varied between 100 to, started for 6.25 microgram per ml to 100. It is put in the other way around, and which shows that higher concentration have definite control over the cells when compared with the control. The control groups are in the dark color, and the test is in the last one. And pH staining, this I told you that you can see the fluorescent under the fluorescent microscopy. You can see, I'm sorry that the PANC1 cells are not visible so much because of the contrast is not fine. The other one you can see the MIA-PACA2, where you can see the cells after treatment. You can see the breaking of the cells, and subsequently it is undergoing the death phase. And this is a fragment that is, first the C is a control. You can see the entire DNA is sitting, it's not at all passing through the gel, and later on you see all these are coming down. And one of the particular experiment we have done is gelatin zymography, where we have used two markers. One is matrix metalloprotease 9 and matrix metalloprotease 2, and we try to evaluate whether the levels are reducing or not. What is the reason behind it? Matrix metalloprotease is one which is secreted during the proliferation of the cancer. They will pass through the basal membrane by degrading the basal membrane using this particular matrix metalloproteases. As a result, they will migrate from one place to another place. That's a reason this shifting of the cancer is causing whether it is originated from pancreas or some other region we cannot identify. So this kind of thing we can understand when you are treating with when you are understanding whether the expression of these protein are controlled. Here you can see the reduction in the expression of the protein, particularly the metalloprotease 9, protease 9 and 2 in a significantly reduced, particularly 9. And here another problem with the cancer cell. Cancer cells require a lot of nutrients for undergoing proliferation. What actually it will do, it will induce a VEGF, that is vascular endothelial factor, through which it can be able to form its own blood vessels, so that it increase the blood flow to the cancerous cell. As a result, they will replicate, and the replication of the cancer cell will faster. To control this one, if you have such a property, if it is having anti-angiogenesis property, then definitely that can become a molecule, can become a drug also. And that's why we have tested in the control. You can see we have tested with the chick embryo. After treatment, what has happened with the 25 micro, that you can see the entire vasculature is reduced in such a way, drastically reduced, and showing, so this can be used as an anti-angiogenic agent to control cancer growth. To conclude, so this is a wonderful source for the anti-cancer molecular leads, and it is effectively scavenging all the free radicals, and it's also having inducing the apoptosis. Of course, we know what is apoptosis, a programmed cell death, and the most of the programmed cells involve the mitochondrial factors and caspase family of proteins, and through which it can be able to control that is all there in another chapter, but I have not included here. And of course, it's inhibited the proteolytic activities of MMP2 and MMP9 and inhibited angiogenesis, and that's why this is a potent source of. Thank you.
Is there any question or comments from audience?
You are welcome to ask questions. Anybody?